Ice or heat. Think of it this way, ice is always safe. Ice is always safe. Heat can damage you, and here's why. Ice will reduce inflammation. Think of it this way, when you're in the summer and it's very hot outside, if you have a ring on, can you get the ring off? You can't get your ring off because everything's swollen because of the heat. Heat causes inflammation, things to expand. If they expand, they can trap the nerve more, trap the pressure in the disc space. If it's an elbow, a shoulder, a knee, a hip, it will compress it, cause more pain. Ice reduces the inflammation. So think of it this way, like when a disc bulges, it will bulge and inflame, it will go back and hit the nerve. So if you heat that up, it's only going to expand and hit more nerve pressure. So when you have heat on, you may say, well, I feel really good, doc. It feels great when I have the heat on. Yes, it does. But then when you take the heat off, half hour later, you usually feel worse because of the inflammation. The pressure got bigger and the pain came back with vengeance. So ice will decrease that joint space. If I put ice on my finger, it'd be really easy to take my ring off because my swelling goes down. So here's when first of all, ice is always safe. If you have a pain, if you bump your knee, you have pain, you ice it, and it's just a little inflammation, it will go away, you'll feel great, on with your day. But if the joint space, and it could be in the spine, in the neck, the back, the low back, and the disc, the hip joints, the knee joints, the elbow joints, there should be that, we talked about before, that big joint space that allows the nerve to work and allows the joint to move freely without any pain. If it becomes chronic, where the joint space collapses and there's not much space there, it's chronic arthritis. So when you get chronic arthritis, you don't really have inflammation because it's been there for 10 or 20 years. So the inflammation's gone, it's just not moving well. So this is a test. So you put heat on it for about 10 to 15 minutes and then go exercise. If you exercise and start light, like in the one video with exercise, if you have joints like this and you exercise too hard, you just deteriorate your joint faster. But if they're like this and you do light exercises after you warm them up or heat them up, you can apply heat, and you do exercise and you put your joint and muscle through a full range of motion and it feels better, then you have chronic joint arthritis in that area. Heat can be very beneficial. It can really help you. You really only need it to get your body moving. Once you're moving, your body produces its own heat. You don't want to keep putting heat on it all day. But it can help you get started. It can help you go to the gym and do the right exercises or the stretching if you're doing those things. But if you do heat and you try to exercise and it gets worse, it's not a chronic condition. It's nerve entrapment. It's something that's damaged. It's tissue that's damaged and inflamed. So at that point, you'll stop, put ice on it, and see what happens. If ice takes it away and you're fine, it's probably a minor problem. You don't need to see a doctor for this. But if this is an ongoing issue where every day you have to put ice on your joint, you have to put ice on your neck to reduce pain and headaches, and you have to keep doing this several days a week or every day, then this is becoming a chronic condition. You need to have an x-ray or specific testing to see where the problem is coming from. Because if you're trying to exercise and move on a joint like this without it being properly aligned and the proper exercises and rehabilitation for this, because you can rehab this, you can improve this. It won't go all the way, but you'll improve it, make it functional. But if you're doing the wrong exercises, all you're going to do is wear this out 6 to 10 times faster than normal. So you're trying to do the right things and it's just not going anywhere. You're seeing your physical therapist, you're seeing your doctor, you get a shot, the shot takes care of it for 3 months and it comes back. Well, wasn't your body was lacking shots, or it wasn't just inflammation. There's a deeper rooted problem that's causing your issue. You have to have specific tests and specific x-rays. That's what we do. We take specific x-rays and then we'll sit down with our patients and show them, look at them, see where is the problem? Is this a spinal problem? Is it a simple muscle problem? Or is it a subluxation that's causing nerve compression? So the ice is always safe. You can always use ice, especially if you just injure yourself. Ice it, reduce the inflammation, and if that helps, maybe all you need on with your day. If you have to continue to rely on ice day after day or several days a week, there's a deeper rooted problem. You need to identify that. Otherwise, all you're going to do is wear it out, or you won't do anything. You'll say, well, I can't exercise anymore, doc. It hurts. Well, why does it hurt? Is it a muscle problem, a joint problem, or subluxation? If you fix whatever the problem is, your body heals, and then you'll be able to exercise. If it's a joint problem, you find out what you have to do to repair and regenerate the joint tissue. And if it's subluxation, you get that corrected and you stabilize it with chiropractic care and some home rehab, and then on you go, and you're fine. So unless you identify the correct problem, then you don't have a solution for it. And what happens is many times you go to the doctor, he'll give you a shot and say, let's see how that is. Well, we don't know what the problem is. He'll give you medication, or she will give you medication to relieve the pain, the symptom, but we don't know what the cause is. Or you go to the gym and you try to relieve the symptom by gym exercises or stretching, or your chiropractor, you may go in and he doesn't x-ray you or she doesn't x-ray you and identify the problem. They adjust you and say, how is that? Well, I want to know, do I have a problem? And I want to know with my patients, do they have a problem? Is there spinal arthritis, or is the joint healthy? If it's a simple muscle problem, simple stretches will work. Is it the disc is actually bulging back and hitting the nerve and degenerating? If you don't fix that, you won't save the disc. You'll be a serious disc problem candidate. It'll ruin your life. So we like to identify and then come up with a proper solution. So try the tactics with ice and heat. If things don't go away, then you're going to have to choose the right testing and the right doctor for you to identify what the cause is. Then they can come up with a solution. So find the cause, come up with a solution, and your life is transformed.